Dr. Veda. It's very nice to meet you. I'll be taking care of you for today's appointment. I see that you were here from a referral from your primary care physician. Okay. And I note that you've had some hearing loss or muffled hearing. Okay. I'm just going to ask a couple of preliminary questions and we'll take a look at your ears, okay? All right. How long has this been going on? Okay, about 2 months. And do you have any pain? No. Pressure? Okay, any feeling of the ears being clogged or like you're underwater? A little bit. Okay. Any crackling or popping? No. Any ringing in the ears, tinnitus? No. Okay. And have you had any loss of balance or dizziness? No. Okay. That can sometimes indicate an issue with the inner ear, so that's good that you haven't had that. Does one ear seem to be worse than the other, or are they roughly the same? Okay, about the same. Now, this issue, did it come on suddenly, like one night, or has it been building over time and getting worse? Okay, it's gotten worse over time. Do you have any history of hearing issues or hearing tests that came back with abnormalities? No. Okay. Have you ever seen an ENT before this? No. First time. Okay. Any family history of hearing loss, deafness, or hearing issues? No. Okay. Any ear surgeries in the past? No. Okay. Now, do you ever clean your ears internally or externally? Yes. Okay. And how frequently do you tend to clean your ears? Okay. And is that externally, just the outside auricle or pinna, or is that in the ear canal as well? Okay. And what do you use to enter your ear canal? Q-tips. All right. Have you ever used ear drops, either to remove earwax or to soothe any pain? No. Okay. Now, one thing I will mention is that we strongly discourage our patients from using Q-tips inside of the ear canal. There's a couple of reasons for that. The first being that you can cause injury to the tympanic membrane or eardrum. The second being that you can actually push back the serum, that's earwax, and create an impaction of serum, and that can actually harm your hearing. It could cause injury to the tympanic membrane. There's a whole host of issues that can come from that, so we strongly discourage using Q-tips inside of the ear canal, okay? But why don't we take a look at your ears? So I'm going to go ahead and put on my gloves. And once my gloves are on, I'm going to start by looking at your external ear. It's your auricle or pinna. And I'm just going to be checking that for any lumps, bumps, abnormalities, discoloration, any lacerations, anything that could be on the outside of the ear. And then once I have done that, I'm going to grab my otoscope and look inside your ears, okay? Alright, so I'm going to start with your left ear. I'm just going to look at the outside ear first. Okay. Yeah, auricle and pinna look good. No lacerations, bumps, redness, nothing. Very clean. Okay. Left ear looks good externally. Let me take a look at the right ear. Okay. Right ear looks good as well. No lumps, bumps, abrasions, and no redness. Very clean as well. Okay. Perfect. Now I'm going to grab my otoscope and put a fresh tip on there. Now I'm just going to use this to enter your ear canal, the external acoustic meatus. I'm going to look around in there and see if we can see any injury to the ear canal or the tympanic membrane, the eardrum. Sometimes if there's a buildup of serum, I'm unable to view the tympanic membrane, and then we can remove some of that serum and get a better look, okay? Alright, so we'll start with the left ear again. Now I am just going to be pulling back a little bit on your ear to make sure we straighten that ear canal and get a good view, okay? Alright, just get in here. External acoustic meatus. Everything there looks good except for quite a buildup of serum, and that seems to be mostly blocking the tympanic membrane. I'm just gonna reorient. Yeah, I cannot get a very good view of the tympanic membrane. So it does look like in the left ear you have an impaction of serum. partial impaction, so that means that your ear canal is partially blocked by earwax, and we'll have to remove that in order to help your hearing issues, and also so that I can take a look at your tympanic membrane and make sure that there's no damage. Okay, right here. All right. I'll just get in there, and again, I'm going to be pulling back on the right ear as well. Okay. All right. Just get in here. Look at that ear. External acoustic meatus looks okay. No redness that I can see, but again, a buildup of serum in. Okay. Yeah, again, partial blockage of the tympanic membrane. I'll have to irrigate the serum in order to view the tympanic membrane. Okay, so essentially what I'm seeing in your ears is a buildup of cerumen or cerumen impaction, which is where your earwax is partially blocking your ear canal. And just grab my ear model here. So if this were your ear, the outside auricle or pinna directs the sound into the external acoustic meatus, which is your ear canal. And if that gets blocked with cerumen, then the sound waves, the vibrations, cannot travel properly to your tympanic membrane or your eardrum. Now, another thing that can happen along with just blocking the ear canal is that if that cerumen gets pushed up against the tympanic membrane, it can dampen the vibrations, which further muffles the sound. So we need to go ahead and irrigate your ears to remove some of that cerumen, so that will improve your hearing, and then we can also get a better view of your tympanic membrane and make sure there hasn't been any damage. Okay? Now, the way we do that, just right here, I have a serumolytic, which is basically just a solution of carbamide peroxide that we will insert into your ears. I'm going to drop this. It's a little dropper. This is a fresh bottle, never used. We go ahead and put this in your ears, and it works to soften that cerumen. Then I'm able to use one of my tools here to scrape out the remaining cerumen in your ear and decrease that blockage. Okay? So you shouldn't feel any pain when we're performing this procedure. You'll probably feel a little bit of pressure and some scraping, but it shouldn't be painful or tender at all. So if you do feel any pain, just let me know. But first, I'm going to go ahead and put some of this solution in your ears so we can start softening that wax, okay? Alright, I'll just start with the left ear again. Okay, I'm going to put the dropper right in your ear, and you just feel like a liquid in your ear. Okay, now I'm going to go ahead and put some in the right ear while that left ear keeps working. Alright, right in here in the right ear. Okay, so that's going to do its magic to start dissolving that cerumen for me. And now I'm going to go ahead and use my tool and enter your ear gently and just start removing that earwax, okay? Alright, so I'm just going to start again with the left ear. And you might feel a little bit of coolness when my tool enters. Okay, just get into that ear canal. Very good. Let me just grab a towel and wipe some of that off. It is coming out. That looks great. Okay. Okay. Alright. Yeah, okay. I was able to get quite a bit of that out. I'm going to go to your right ear now. Remove some as well. Clean that off. Okay. Just get into your right ear. You don't feel any pain, correct? that's working very well. That serum worked wonders on softening this wax so I could get it out. Okay. Very good. Go ahead and look back in there with the otoscope. Okay. Left ear. Okay. That looks quite a bit better. I still see some impaction. And right ear as well. Okay. So those both look quite a bit better, but still some impaction. So I'm going to put a little bit more of our solution in. And generally we have to do this because it doesn't penetrate the whole way into the ear canal. So put a little bit more in, let that soften up the remaining, and then we'll pull it back out, okay? Excellent. Okay, right here. Okay, perfect. Thank you. So have you ever had this issue before with earwax where you've had to have it removed like this? No? Okay. Yeah, some people just produce more wax. I'm going to come back in here with my tool and start the scraping again. Some people just genetically produce more wax. And like I said, they need to periodically have it removed. But I'm going to go ahead and set you up with a prescription for some drops. That should help. So that you won't have to come back here anytime too soon, okay? Okay. I'm just going to come back around to the other ear. Okay, your right ear. Yeah, I'm glad you came in to have this done because you definitely had quite a blockage in here. You should feel much, much better after this. Okay. Alright. Take another look. So coming back in with my otoscope. Oh, that looks a million times better. I'm going to pull back here on your ear again, straighten that ear canal so I can see your tympanic membrane. Okay. Yep, I can get a full view of your tympanic membrane now. That looks wonderful. So no damage or anything to the tympanic membrane. Ear looks fantastic. Look at the right ear as well. Okay, I'm going to pull back on your ear again. It's like the other time. Okay, and same thing. Okay, external acoustic meatus looks fantastic. I can see all the way to your tympanic membrane. And tympanic membrane is intact. Alright. That looks so much better. Okay, I can see all the way into your tympanic membrane, which is your eardrum. See that there is no damage to it. It looks like everything is fine. Do you hear better now? Does it feel like that clog has been removed? Okay, perfect. So I'm going to go ahead and your ears probably feel a little bit wet inside, so I'm going to take a Q-tip. This is the one time it's okay to do the Q-tip in the ear. I'm going to go in very gently and dry that out for you. And then we'll do a very quick hearing test just to make sure that everything is 100% back to normal, okay? Alright. So let me just come in here to the left ear. Just get in there and clean that out. Okay, perfect. And right ear, same thing. that should feel much better. All dry, nothing in there anymore. Okay, now I'm just going to do a quick hearing test on both sides of your ears. So I'm going to start by just whispering something into your ear, and I would like you to repeat it back to me, okay? Alright, let's start with the left side. Blue 15. Good. Okay, right side. Red 11. Good. Okay. So I'm just going to go ahead and grab a pair of headphones that have been sterilized. And I'm going to use these for the second part of the hearing test, so I'm going to put these on your ears, okay? Alright. There you go. Now you should still be able to hear me just fine. The headphones have open backs, but you'll also be able to hear the beeps when we start the test, okay? Alright. So I'm going to start a beep in one ear or the other. I'd like you to tell me what ear you hear it in, okay? Okay, and when you hear the beep. Okay. Good. 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 Okay. Okay, now we're going to do your left ear to start, and I'm going to play 2 beeps. And I want you to tell me whether the second beep was in higher in pitch or lower in pitch than the first beep, okay? So, okay. Which was higher in pitch? The second one, good. Alright, same thing on your right ear. So I'm going to do 2 beeps. Tell me which one was higher in pitch. Okay. The first one. Okay, very good. Now, the last part of the hearing test, I'm going to go ahead and start a sound in the left ear. And I'm going to gradually allow it to be quieter. I want you to raise your hand when that sound has stopped playing for you, okay? Alright. Okay, very good. And the right ear will do the same thing. Okay, ready? Very good. Okay, so I'm just going to go ahead and take those headphones off now, alright? Okay, thank you. Now, your post-testing came out perfect. Hearing seems to be back to normal. Very good hearing. Do you feel like you still have any muffling or issues with your hearing? No, not that you can tell. Okay. Well, the hearing test came back normal, so you should be okay. I'm going to prescribe you some drops for your ears that you can use once a week, and that should prevent this issue from happening as quickly in the future. You may need to eventually come back just for another cleaning, but it should at least prolong your time between visits, okay? Alright. So your prescription is going to go right to your pharmacy if you'd like. What pharmacy do you use? Okay. And that's the one on King Street? Perfect. So I can have that sent over to your pharmacy for you. It should be ready to pick up later today or tomorrow, depending on how quickly they have it ready for you, okay? Alright. Okay, and I would suggest you start using that a week from today, okay? Alright, no more Q-tips inside the ears, please. I don't want you to injure your eardrums. So the drops should prevent any buildup of earwax. You shouldn't need to put anything in your ears other than the drops, okay? Do you have any questions for me? No? Okay. Well, if you do find this issue occurring in the future, just give us a call back. You don't need a referral from your primary care physician. Just come in and we can do the cleaning again, okay? Alright. Well, hopefully those drops will work for you for quite a while, but if you do need to call, I'll be here. Alright. You have a great day,